2020. The committee is meeting for the purpose of receiving evidence concerning matters related to the government's response to the COVID-19 pandemic. In order to facilitate the work of our interpreters and ensure an orderly meeting, I would like to outline a few rules to follow. Firstly, interpretation in the video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen, and that's for people on a PC, of either floor, English, or French. If you're on an iPad, that's slightly different, but you have the same choices. If you will be speaking in both official languages, please ensure that the interpretation is listed as the language you will speak before you start. For example, if you're going to speak English, please switch to the English feed, then speak, and this allows for better sound quality for interpretation. Before speaking, please wait until I recognize you by name. When you are ready to speak, click on the microphone icon to activate your mic. Should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. A reminder that all comments by members and witnesses should be addressed to the chair. And when speaking, please speak slowly and clearly. When you're not speaking, please ensure your microphone is on mute. If you have earbuds with a microphone, please hold the microphone near to your mouth when you're speaking. Should any technical challenges arise, please advise the chair or clerk immediately, and the technical team will work to resolve them. Before we get started, can everyone click on their screen? And for those with a PC, it's in the top right-hand corner to ensure that they're on gallery view. With this view, you should be able to see all of the participants in a grid-like fashion. It will ensure that all video participants can see one another. I would now like to welcome our witnesses. Each witness will have 10 minutes. Each witness group will have 10 minutes for an opening statement, followed by the usual rounds of questions from members. So we have on our panel today, we have from the Canadian Trucking Alliance, we have Mr. Stephen Lukowski, Mr. Jeffrey Wood, Mr. Lukowski is president. Mr. Wood is Senior Vice President, Policy, and we have Lak Shoan, Director of Policy and Industry Awareness. From manufacturers and exporters, we have Mr. Matthew Wilson, Senior Vice President, Policy and Government Relations. From the Canadian Produce Marketing Association, we have Mr. Ron Lemaire, President. And from the Canadian Union of Public Employees, we have Amanda Weiss, Ms. Weiss, Senior Research Officer, Ms. Black, Ms. Lou Black, Research Director, Hospital Employees Union. So we'll start with the Canadian Trucking Alliance. Mr. Lukowski, please go ahead, 10 minutes, please. Mr. Lukowski, you're muted still.
Oh, can you hear me now?
Start over, please.
Yep. Thank you very much, folks. Thank you very much, Mr. Chair and committee members, for having the Alliance here today. I'll be flying solo. It's Stephen Lukowski, President, Canadian Trucking Alliance. CTA represents over 5,000 trucking companies from coast to coast, serving all sectors of the economy. CTA would like to open our comments by thanking the Government of Canada for its tremendous support throughout the COVID-19 crisis. Our sector touches multiple sectors and multiple ministries. Numerous departments and offices have worked with CTA in a collaborative manner in extremely trying circumstances. We want to thank all departments for their assistance. It truly has been tremendous. Special thanks to Minister Garneau and his team, who have been outstanding in working with our sector throughout this crisis. I'll give a little bit of an overview with regards to...
Pardon me, Mr. Lukowski. Could you maybe move your mic a little closer to your mouth?
Is it better now?
We'll see. It's very difficult for translation sometimes. They have an extra requirement for sound quality. So thank you.
Okay. I'll provide an overview here with regards to the economic condition of the industry and the specific acts of our sector as a result of COVID-19. The Canadian trucking industry has worked hard as it can during the crisis to ensure Canadians continue to have access to essential items such as food and sanitary products. but it's become increasingly clear that as our industry continues to serve the supply chain and the economy as required, it faces its own unique challenges and rapidly escalating challenges that requires tailored solutions to protect the stability of the supply chain during the COVID-19 crisis and into an eventual economic recovery. The government of Canada has introduced several much-needed financial measures to assist Canadians and businesses generally suffering financial hardship as a result of this pandemic. But simply put, our sector needs additional focused assistance above what the Canadian Emergency Wage Subsidy provides due to the nature of our sector and the critical relationship it has in the supply chain. Also, the CEWS may work for many sectors, but it simply doesn't stabilize the trucking industry enough, and I'll explain a little bit why that's the case. To ensure the stability in the supply chain, CTA is asking the Government of Canada to introduce a payroll tax deferral program, providing fleets the needed cash flow to main operations. Additionally, CTA wants to increase the meal allowance for all truck drivers who are facing rising costs associated with operating during COVID-19. For our payroll ask, we are asking a 3-month deferral with a 12 to 18-month payback, very similar to the GST-HST program introduced earlier. Meal allowance for drivers, what we are asking for is an increase in the daily amount in percentage that a driver can deduct from their taxes as it relates to meal costs on the road. Other organizations like Teamsters Canada, the Independent Truck Drivers Association, referred to as OIDA, the Private Motor Truck Council, and the Women's Trucking Federation of Canada have joined CTA in its call for both the payroll ask and the meal allowance ask. Why are we asking for these measures, these tax measures? CTA recently performed a business conditions survey, which will actually introduce some new findings later on this week. But during our first round of the surveys completed in early April, on average, carriers experienced a 27% decrease in revenue, and since then, we're expecting the number to come in at around 35%. Carriers are also seeing empty miles increase significantly. Empty miles, what that refers to in our sector, is when a truck is moving empty. Obviously, the goal of any trucking company, Business 101, is to move from point A to point B and point B to back point A with goods in their trucks. What's happening during the COVID-19 crisis? There's product going one way, but nothing coming back. And that means our costs stay the same and the revenues are dramatically decreasing. 63% of fleets have indicated that their customers have asked for payment deferrals. Typically, our carriers would collect from their customers within 35 to 40 days. That's being pushed to 60 to 90 days and over 90 days. As I mentioned, we'll have new results of our business conditions survey later this week. With regards to driver respect and treatment, before COVID-19, the issue of driver respect at shipper and receiver facilities was a significant issue. After the onset of COVID-19, when drivers were regularly refused access to washrooms and could not get food on the road because of drive-through policies, which did not accommodate commercial vehicles, CTA launched a hashtag campaign called Thank a Trucker to help raise awareness to address these issues. The response from government, the Government of Canada, provincial leaders, corporate Canada, and regular citizens has been incredible.
Pardon me, Mr. Lukowski, could you just slow down a little bit as well?
Yep. Our industry is appreciative of this response, but there's still work to do. We're on the right path, and we'll hopefully continue to see improvements in this area. With regards to crossing the border, as we all know, 70% of our trade it moves by truck from both from Canada into the United States and from the United States back into Canada. The border has undergone significant changes since the restrictions of non-essential traffic. We'd like to thank CBSA for working with our industry and the trade community. This transition wasn't easy, but they dealt with it very well and worked with our sector and importers and exporters to make it go as seamless as possible. According to CBSA, the number of trucks currently entering Canada from the U.S. has fallen nearly 33%. this coincides exactly with what we're saying with our business conditions survey. CBSA has also worked collaboratively with the Public Health Agency of Canada in ensuring that border interactions with our drivers remain safe from a health perspective. It's been a good process. CTA will continue to work with CBSA to ensure the Canadian economy moves in a safe and efficient manner across the Canada-US border. With regards to commercial vehicle licensing, plates, permits, and regulatory flexibility, CTA would like to once again thank Transport Canada, the Canadian Council of Motor Transport Administrators, and all the provinces and territories who have worked with CTA and its members on regulatory flexibility with respect to extending the validity of license plates, driver's license, driver medical exams, in addition to many other compliance-related requirements, such as annual vehicle inspections and accommodations under the International Fuel Tax Agreement. We would also like to thank the regulatory and enforcement agencies in both Canada and the United States for working with us with regards to interaction with our drivers in a safe manner during the COVID crisis. With regards to PPE, the Minister of Public Services and Procurement announced recently this week that she will bring together a diverse group of 17 private sector leaders to form the COVID-19 Supply Council. This group, which includes the Canadian Trucking Alliance, will be tasked with providing the government advice on the procurement of critical goods and services required as a part of the COVID-19 response and recovery efforts. We look forward to working within this committee and council, and thank the Minister for the invitation. With regards to securing personal protective equipment for drivers, including face masks, gloves, hand sanitizers, and disinfectant wipes, this continues to be a challenge for our sector and others, but we continue to work with it to ensure our drivers are protected. Thanks again. That is the end of my remarks. Thank you, Mr. Chair and committee members, and I look forward to any questions.
Thank you, Mr. Lakowski. We go now to manufacturers and exporters. Mr. Wilson, please go ahead, 10 minutes.
Thank you very much, and good morning, Mr. Chair and committee members. Thank you for inviting me to participate in today's discussions. It is my pleasure to be here on behalf of Canada's 90,000 manufacturers and exporters and our association's 2,500 direct members to discuss COVID-19 and Canada's manufacturing sector. CME's membership covers all sizes of companies from all regions of the country and in all industrial sectors. From the early days of this crisis, we've been working with our members and governments to increase the manufacture and supply of critical PPE and healthcare technologies needed in the response. We've also been educating and informing the manufacturing sector in the latest developments in the crisis, including on how to access government supports and how to protect their employees and supply chains. And we have been working to understand the impact on our sector and advocating for policy and regulatory and program supports from all levels of governments. Like the CTA, we'd like to thank all levels of government for their efforts to date. Their actions through this crisis have been, frankly, remarkable, and the partnership is well noted by industry and the CME right across the country. In the public, there tends to be two areas of discussion as it pertains to manufacturing COVID-19. How can Canada manufacture more of our own healthcare products, and how can manufacturing continue to operate safely during the pandemic? I will touch on both of these issues and hope to provide some advice to the committee as you look to form Canada's response. With support given by CME and other groups, and of course the government across the country, the manufacturing sector has performed exceedingly well throughout. The sector has largely maintained production and employment of the nearly 1.7 million Canadians who work in manufacturing. Hundreds of companies, if not thousands, have changed their production to making health products, including critical PPE, such as masks, ventilators, face shields, and gowns. Others are aggressively working on developing better tests and vaccine for COVID-19. This does not mean things have gone as smoothly as hoped for. The challenge,
Pardon me, Mr. Wilson. I think interpretation is having difficulty. Could you
closer?
Yeah, try to speak very clearly and maybe a little slower.
Okay.
And carry on. Thank you.
Okay. This does not mean things have gone as smoothly as hoped for. The challenge in standing up domestic industry to produce goods for the crisis has largely been a lack of understanding of what products were needed and in what quantity, the technical specifications of the products, and who could produce each part necessary, and the regulatory approval processes needed before delivery. However, product by product and issue by issue, we have worked with a range of companies and government officials to help patch together the solutions needed to deliver the products. There are three areas that CME suggests we focus on to improve response times for any possible future crisis. First, conduct a complete mapping of Canada's domestic manufacturing capabilities. The challenge...
I'm sorry, Mr. Wilson, they're having difficulty still. Maybe we'll suspend for a couple of minutes and we'll get this sorted out. So the meeting is now suspended. You, Mr. Wilson. Thank you.
My apologies. There are three areas that CME suggests we focus to improve response times for any possible future crisis. First, conduct a complete mapping of Canada's domestic manufacturing capacities. The challenge in standing up the domestic supply chain wasn't who could manufacture the final product. It was in what subcomponents were and who could manufacture each piece. If we knew what is made in Canada, we have a better chance of connecting the various elements of the supply chain to make the goods that are needed, regardless of the crisis. Second, there should be a full alignment on production and supply of healthcare equipment between Canada and the United States in a similar way to how we cooperate in defense production. This would reinforce and strengthen existing North American supply chains and provide continual access to this critical equipment. Third, Canada should strengthen domestic procurement in two ways. First, more coordination is needed on what equipment is needed and by whom. And second, Canada should establish the health equivalent of the US's Defense Advanced Research Projects Agency, or DARPA. In short, Canada could set aside a small percentage from the company's nearly $200 billion in public healthcare spending for research, development, scale-up, and commercialization of new health innovations that could be procured by government and possibly spun into consumer-focused products. This would allow us to create new products and technologies to improve healthcare for Canadians and to develop new export growth opportunities. The second area that's getting a lot of attention from policymakers and public is around safe manufacturing during and following the pandemic. The sector was deemed an essential service by the federal government and most provincial governments. Production has continued throughout the crisis, although with enhanced safety practices and at much lower volumes. Social distancing in most manufacturing environments is standard practice, with workers operating in stations safely at a distance from each other. And the rare occasions where there have been found, problems have been found, the facility has been immediately shut down. All workers have been sent home and the entire facility has been cleaned to provide a safe work environment. The challenge, like the healthcare system, is that manufacturers rely on the same N95 masks and other protective equipment as frontline responders, which has been difficult to procure. CME itself has been working with their members to provide them the best guidance possible to protect their operations and workers. We have developed industry-leading safe operating guidelines, and we're continually training companies to provide support to maintain their operations. However, as the economy turns to normal and companies look to ramp up production, there will be tremendous new costs for industry that government should look at supporting. This could include an investment support programs to bring plants up to new health and safety standards and training offsets to cover the training of all new employees and new protocols that will surely be developed. Thank you again for inviting me here today, and I look forward to the discussion.
Thank you, Mr. Wilson. We'll go now to the Canadian Produce Marketing Association. Mr. Lemieux, President, go ahead, please, 10 minutes.
Thank you. Honourable members of the Standing Committee on Health, on behalf of the Canadian Produce Marketing Association, I would like to thank you for the opportunity to speak today about the Canadian response to the outbreak of COVID-19. CPMA is a 95-year-old not-for-profit trade association representing over 860 companies doing business in Canada. Supporting roughly 249,000 jobs, we are responsible for 90% of the fresh fruit and vegetables purchased by Canadians. Our comments reflect a complex supply chain that works tirelessly to provide fresh fruit and vegetables across Canada. I will speak to the impact of COVID-19 as it relates to the continuity and integrity of the fresh produce supply chain and food security in Canada. These areas of impact include consumer sentiment, mental health, food security, food labeling, infrastructure, regulatory modernization, trade, and sustainability, including plastic packaging. To understand how the current pandemic is affecting consumers, and by extension, the fresh produce supply chain, I will note what CPMA's polling firm, Abacus Data, found when surveying Canadians just over 12 days ago. No surprise, 76% of Canadians feel anxious, and 45% are now feeling lonely. The majority of Canadians feel this pandemic will last beyond 3 months, putting a greater mental stress upon them. Abacus also noted that 47% of Canadians are feeling the impact financially. CPMA has seen Canadians doing more targeted shopping, resulting in larger baskets with a focus on longevity. So more shelf-stable products like canned and frozen. And for fresh items, the focus is more on traditional staples such as potatoes, root vegetables, apples. What we also know is Canadians are focusing on safety. And for many, this translates into more packaging, which I will talk to later. Interestingly, the pandemic has also driven more consumers to do more home cooking. CPMA consumer program Half Your Plate is aligned with Canada's new food guide. And given that 54% of Canadians are now cooking more at home, CPMA has developed tools to support them. This includes a one-page produce storage guide that simplifies the best way to store produce, information on how to safely and properly handle produce when they get it home from the store. We've increased the amount of information involving children in the kitchen, including easy recipes, tips for parents, and links to resources. And while there's a perception that all fruit and vegetables are expensive, the association provides Canadians with shopping tips to get the best value from their basket. With Canadian buying patterns shifting during the pandemic, we've seen retail sales up 8% for vegetables, 5% for fruit. But consumers are spending less time browsing grocery stores and unique items, and the sales of short-term shelf life products or specialty items are lower. Given the closure of many food service operations, there has been a dramatic impact on the entire sector, which represents 30% of our market. There has been some rebound with delivery options, but the market is still very fragile. In a recent industry survey, Canadians say that they look forward to visiting restaurants again, but are concerned about personal safety once businesses reopen. While consumer buying patterns have changed, food security has been top of mind during the pandemic. With many Canadians' employment status changing, there is an increased reliance on food banks. The produce industry is aware of this issue and has significantly increased levels of donation to help. Unfortunately, food banks and other food charities still have gaps. While there is plenty of food to donate, many charities do not have the necessary cooler facilities to handle the volume of fresh produce, resulting in losses of donated products or the charity declines the offer of product donation. Also, the lack of volunteers who would normally support their services to receive, pack, and ship much of the product is still a challenge. Throughout everything, there are positives, including the flexibility on labeling. The larger format items typically destined for and labeled for food service establishments are now allowed to be sold through other channels. This is a positive. We are aware that work is also being done by CFIA to enable some flexibility in consumer package labeling where it does not affect health and safety. This is also supported by CPMA. I'd like to now turn to recovery. Business continuity and the challenges business continuity will be challenging as we transition into the post-COVID world. The simple decision to reopen for some parts of our supply chain will be the first step, and for many, it will not be possible. Government programs created to support the produce industry must be based on flexibility and longevity to minimize losses to the industry. The complexity and variability of the industry means program adaptability on both a large and small scale must be incorporated into any programs moving forward. To that end, another area of impact the produce supply chain which influences food production is foreign labor. Access to temporary foreign workers, or TFWs, which early in the pandemic was the single most threat to food production, food security, and the integrity of the food supply chain remains an issue. While the issue of labor has been addressed to a point, there is still a need to revisit the protocols for workers in Canada. TFW protocols vary from municipality to municipality. More work must be done to support an efficient model for managing and streamlining isolation protocols. Audits from multiple levels are also now being implemented, and consistency is essential. The addition of rapid testing for essential farm workers to ensure business continuity and production is also an area of interest. From the start of the pandemic in Canada, CPMA members worked diligently to perform and implement measures that will protect employees, the public, and the food system. In a recent member survey, access to personal protective equipment is the #1 area of concern. Public health and public safety guidelines have resulted in member companies' need for a much greater access to cleaning, sanitation products, and PPE. A new supply chain for these products is vital. Organizations cannot continue to operate without appropriate cleaning and sanitation to ensure food and employee safety. A self-sufficient Canadian PPE supply chain should be one of the government's long-term goals. We are also supportive of the Public Health Agency of Canada developing guidance regarding which type of PPE are required based on the risk associated with various activities and environments found in Canadian businesses. Testing of employees for the COVID-19 virus or symptoms of infections should be available to employers within our sector, which is designated an essential service. Once sufficient and affordable testing equipment is available, Public Health Agency of Canada should create guidance to support businesses implementing point-of-care tests. Earlier, I noted plastics as packaging. CPMA is deeply engaged in addressing problematic single-use plastics in our sector. These are important tools to minimize contact between consumers and commodities or food items. Since the COVID outbreak, consumers have demonstrated a desire for plastic packaging by increasing their purchase of these items. We do not know how this will change post-COVID, but need to recognize this shift today and the need for systems to address collection and recycling of these products. I urge the government not to add plastics to the Canadian Environmental Protection Act list of toxic substances. More review is necessary. We suggest a focus on working with industry to identify and eliminate problematic single-use packaging while improving recycling and recovery of plastics across Canada, which will provide the best possible outcomes. During this pandemic, we also realized our reliance on global trade. To ensure the ongoing viability of the food system, we need a strong domestic and global strategy. Market access is critically important to the Canadian produce sector. In successful access to key markets, the supply chain linkages of transportation, border access, and ports of entry and exit must be maintained. In addition, international trade agreements, phytosanitary rules, and cooperation between governments must continue to be harmonized. The supply chain is multinational, so a failure in one area has consequences along the entire supply chain. CPMA encourages the government to undertake a pandemic postmortem in partnership with industry to help understand how this crisis affected Canadians and Canadian industry so we can better prepare for the next occurrence. Overall, we have all gone through tremendous challenge in a hyper timeline. The new business environment has added costs to our entire supply chain, which will be difficult to quantify and to bear. In the end, we do know one thing: food will cost more. In closing, I want to recognize the extraordinary efforts of government, both elected and public servants, throughout these unprecedented times. Thank you for your time, and I'd be happy to answer any questions you may have.
Thank you, Mr. Lemaire. We go now to the Canadian Union of Public Employees. Ms. Weiss, please go ahead, 10 minutes.
Thank you very much, Mr. Chair. The COVID-19 pandemic is not affecting all Canadians equally, as evidenced by the horrifying number of deaths of individuals living in long-term care homes across the country. Lou Black and I would therefore like to thank all members of the committee for inviting us to appear before you to talk about the realities of long-term care and the reforms needed to improve quality of care in facilities across the country. The Canadian Union of Public Employees is Canada's largest union, with 700,000 members across the country. 65,000 of our 158,000 healthcare members work in long-term care homes in every province, with another 50,000 represented by HEU, the healthcare division of QB in BC. Within long-term care, HEU represents care aides, food service workers, cleaners, and clerical staff. Residents of long-term care and other seniors' homes now account for 79% of all 3,854 COVID-19 related deaths in Canada. Long-term care staff have had to work without access to a ready supply of adequate personal protective equipment. Restricting family members from visiting long-term care homes is a necessary measure to help prevent the spread of COVID-19. But family members can check in to advocate for residents and ensure they're well cared for. They also can't be with their loved one to offer comfort when they're dying, so residents are facing their last days alone. Over the past month, people have repeatedly asked us, why have long-term care homes been so hard hit by COVID-19, and how could we let this happen? COVID-19 didn't create the deadly crisis we're facing in long-term care. The systemic issues that facilitated this heartbreaking situation existed long before this moment. What the pandemic is doing is shining a spotlight on those problems and making them worse. This situation is totally unacceptable.
For the past decade, QP and HEU have repeatedly pleaded with their governments to make improvements to long-term care, including national care standards, increased funding, better working conditions, and the construction of new public facilities. Unfortunately, we met more resistance from most levels of government than a willingness to reform the system's state of disrepair. Many Canadians are longing for life to get back to normal. However, when it comes to long-term care, we must not go back to the way things were. Long-term care homes house people who require care 24 hours a day, 7 days a week. Most residents are frail seniors living with chronic medical conditions and physical and cognitive impairments. Unlike hospital and doctor visits, long-term care is not a core publicly insured service under the Canada Health Act. Instead, the sector is governed by a patchwork system of provincial and territorial legislation and regulations. There's little consistency across Canada in the level or type of care provided or how facilities are governed. Where you live will affect the type and amount of care you'll receive and how much you'll pay for it.
Pardon me, Ms. Black, the interpreters are having trouble. Could you make sure your mic is kind of near your mouth? And you are speaking very clearly, but they're just having trouble. So, okay.
Okay, great. Thank you.
Try again. Carry on.
You'd like me to sorry,
No,
Amanda,
yes.
over to you.
Oh, sorry, just carry on.
Thank you, Mr. Chair. Medical and personal care are delivered to residents by a facility's care aides and registered and licensed practical nurses. Most care aides are women, and many are racialized and immigrant workers. Care aides perform the most labor-intensive hands-on care to residents, yet they are very low paid. Starting wages are as little as $12 an hour in New Brunswick, and there are large wage variations within provinces. The median wage in Canada is just over $20 an hour, but it can take a care aide 10 years to reach that scale. Care aides perform upwards of 90% of direct care to residents. Their work is complex and requires a high skill level. In Ontario, care aides have 6 minutes to get a resident up and ready for the day. Within 6 minutes, they must help transfer the resident out of bed, assist with toileting or change incontinence products, help the resident get dressed, perform oral hygiene and other personal care, and assist the resident to the dining room for breakfast. Staffing levels in long-term care are typically measured as the number of hours of direct care a resident receives daily. A landmark study conducted in the United States established that the minimum staffing level required to prevent a deterioration in a long-term care resident's health and to ensure good quality of care that is timely and consistent is 4.1 hours of directly worked hands-on care per resident per day. No province or territory in Canada is currently meeting this minimum standard of care.
Privatization and contracting also have a negative impact on working conditions and the conditions of care. Research on for-profit ownership of long-term care homes shows that for-profit homes are more prone to closure, focused on profits rather than quality care, have lower staffing levels, more verified complaints, more transfers to hospitals, and higher rates of pressure ulcers and morbidity. The first COVID outbreak in long-term care in Canada occurred in the Lynn Valley Care Centre in British Columbia. 12 years ago, staff at this facilities were members of our union. Staff had decent working conditions, pay, and benefits. But in 2002, changes to the province's labor code opened the door to privatization and eliminated union successorship rights. If a service was contracted out or home ownership...
Ms. Black, the translators are having difficulty again. I'm not quite sure what...
Sorry, is it with the volume or speed?
Yeah. Let's suspend for a couple of minutes and we'll get this sorted out.
Sure.
So the meeting is now suspended. resumed. We will carry on with Ms. Weiss, with apologies to Ms. Black. Thank you.
So I'll just back up a little bit to where Lou left off. So Lou had mentioned that the first COVID-19 outbreak in long-term care in Canada occurred in the Lynn Valley Care Centre in BC. So 12 years ago, staff at this facility were members of our union. Staff had decent working conditions, pay, and benefits. However, in 2002, changes to the province's labor code opened the door to privatization and eliminated union successorship rights. If a service was contracted out or home ownership changed hands, workers' collective agreements no longer formed part of the deal. 30 years of positive wage and other gains were totally gutted. Workers were terminated en masse. Others were forced to reapply for jobs at half their former wages, with fewer benefits and far fewer sick days. Recruiting and training staff has been an uphill battle for Lynn Valley. The casualization of the long-term care workforce is predominant and growing across Canada, especially as the number of for-profit long-term care homes increases. Because they're paid low wages, care aides across Canada work multiple jobs in order to cobble enough hours together to pay the bills. The pandemic has drawn attention to this issue since long-term care staff who work in multiple homes have unwittingly spread the virus between facilities as they've moved from job to job to job. Several provinces have issued orders restricting staff to employment at a single worksite as a temporary measure intended to protect residents. Another serious problem staff in long-term care face is injury, both from musculoskeletal injuries, which result from heavy lifting and repetitive strain, as well as workplace violence. In BC, injury rates for the long-term care sector are 4 times higher than the average provincial injury rate. Workplace violence is also a serious everyday health and safety issue for long-term care workers. A poll conducted in Ontario showed that 90% of care aides and registered practical nurses have experienced physical violence in long-term care settings. Because the system is characterized by low wages, precarious jobs, and high levels of injury and violence, it's extremely difficult to recruit and retain workers. As a result, long-term care homes have been dangerously under or short-staffed for over a decade. When staff call in sick, they're often not replaced by another worker. For the remaining staff on shift, they must add more work to their already heavy workload. When this occurs, staff rush from resident to perform care. For residents, it means they may not receive their bath, their call bell may go unanswered, or they may sit or lay in a soiled diaper for hours. When workers don't have adequate time to perform necessary tasks, the quality of resident care suffers. In BC, Retirement Concepts purchased the largest chain of for-profit long-term care homes in the province in 2017. Since then, public health authorities have taken over the administration of 4 of these homes. Wages were so low, the workload impossibly high, they could not recruit or retain staff. In a survey conducted by HEU, staff at one site reported their staffing ratio at night was as low as 1 care aide for 75 residents. Residents were reported to routinely go without their weekly bath or be toileted in a timely manner. Health authority staff were redeployed to each site to stabilize the situation. With high numbers of long-term care workers testing positive for COVID-19 and needing to self-isolate, the difficulty employers have to fully staff homes has been compounded. Provinces across Canada have asked retired healthcare workers to return to service to help out. Hospital staff have been redeployed to fill in the gaps. With the situation so bad in Ontario and Quebec, the province's premiers requested and are receiving assistance from Canadian Armed Forces medical personnel. It's unacceptable that our governments have allowed the conditions in long-term care to deteriorate to such a great extent. The pandemic has shown Canadians how fragile our long-term care system has become, from underfunding, understaffing, and a political willingness to allow the profit-making interests of private companies to trump the public interest when it comes to the provision of care for our most vulnerable. It's time for our governments to take meaningful action to improve the conditions of work and the conditions of care in facilities across the country. CUPE and HEU members offer the following recommendations to the committee. First, the federal government must work with the provinces and territories to bring long-term care into the Canada Health Act and make it a core, publicly insured healthcare service that's publicly administered, accessible, universal, comprehensive, and portable. Second, the federal government must provide dedicated and adequate funding to the provinces and territories for long-term care through the Canada Health Transfer. Third, the federal government must implement and enforce a national standard of a minimum of 4.1 hours of directly worked hands-on care per resident day and tie the standard to funding. Fourth, governments must work collectively to eliminate the private for-profit ownership of long-term care homes. Private corporations and shareholders should not profit from people's medical needs, and governments should not put their health up for sale. Fifth, long-term care homes must stop the contracting out of services to for-profit companies such as frontline care, laundry, housekeeping, and food services. All services should be provided by in-house staff to enhance working conditions and quality of care. Sixth, the wages of workers in long-term care must be standardized and increased to reflect the value of their work and their role in providing an essential service, especially for care aides. Workers should be provided good benefits, including adequate paid sick days. Seventh, the casualization of the long-term labor force must be eliminated through the creation of full-time, regular jobs for workers who want them. Finally, by 2035, it's expected that Canada will need an additional 199,000 long-term care beds. Hospitals have long operated well over capacity because there aren't enough long-term care beds for individuals who are unable to live independently in their own home. This situation became more alarming when hospitals had to rush to find ways to handle the expected influx of COVID-19 patients. The pandemic therefore reinforces how urgent it is to increase the number of long-term care beds across Canada in order to alleviate capacity problems in hospitals and to ensure individuals receive the appropriate care they need when they need it. Public funds should be available to build new beds, and the facilities must not be designed or operated as P3s. Thank you very much, and both Lou and I welcome any questions you may have.
Thank you, Ms. Weiss. So we'll start our questioning at this point. As normal, we will have 3 rounds of questions. We will start the first round with Mr. Doherty, the voice of the Caribou. Please go ahead, Mr. Doherty, 6 minutes.
Apologize to our guests for the challenges that they're experiencing in delivering their messages. I do want to start off with our guests from CUPE. I want to say thank you to you both for sharing your stories. My mother was a long-term care aide, and my brother still is a nurse's assistant working in a long-term care facility. Your comment regarding physical damage and violence is the reason why my mother had to retire early. She still has rods in her back, steel rods in her back, and is mobility challenged because of violence. It also led me to take into the steps that my colleague, Mr. Davies, has done in previous parliaments in putting forth a piece of legislation, violence against our healthcare workers. I tabled earlier this year Bill C-211 that includes violence against healthcare workers and first responders. So I thank you for your comments. Ms. Weiss, in a recent article, your president, Michael Hurley of CUPE's Ontario Council of Hospital Unions, was quoted as saying more than 20% of our confirmed cases are healthcare workers, with 68 testing positive so far. Such high numbers suggest workers don't have adequate PPE. When you look at the numbers of healthcare workers who are currently reported as having COVID against the number of cases in the general population, one can only conclude that there has been a colossal failure to protect healthcare workers, and that it is all about failures of ordering enough equipment. Do you stand by your president's comments?
Go ahead, Ms.
Thank you, Mr. Doherty. So I would just like to clarify, first of all, that Michael Hurley is the president of the Ontario Council of Hospital Unions. Initially, long-term care was sort of the long-forgotten cousin of other sectors within the healthcare system, primarily hospitals. So initially, workers in the long-term care sector did not have adequate access to PPE. Some workers in some homes were outright denied access to PPE. In other cases, it was being locked up and very tightly rationed. We believe that workers are now gaining more access to PPE, but early on it was certainly a dire problem that we believe did contribute to the spread of the virus throughout long-term care homes.
Okay. Thank you. Earlier in April, there was a survey that came out in Manitoba that said 58% of healthcare support workers surveyed felt like they haven't been provided with
Pardon me, Mr. Doherty, your sound quality just got really, really bad. Could you just try this question again? Be very careful, speak clearly and carefully.
Testing 1 2 3 1 2 3. Is that better?
It's very crackly, very, very broken up, but we'll try.
I don't know what else I can do here. Is it better now?
I'm not sure. Speak a little bit more.
1 2 3 1 2 3.
Yeah, there's a lot of noise on your on when you speak, so I'm not sure what the problem is, but we'll try and see if the interpreters are able to manage it. But just speak a little bit slower and more carefully, and I'll give you a little bit extra time to accommodate.
Sure. A recent survey, 58% of healthcare support workers surveyed felt that they hadn't been provided with enough PPE. Of home care workers, 77% of respondents reported a lack of PPE. I wonder if those numbers are still accurate, Ms. Weiss.
Sorry, I just had to unmute there. That would be something that I believe we would have to check in on with our membership to determine if the situation has indeed improved since those figures were last published.
Okay, thank you. To the Canadian Trucking Alliance,
Mr. Doherty, your voice, the interpreters can't hear you at all. We'll suspend for a couple of minutes and we'll try and get your sound sorted out. Meeting is suspended. resumed. Please carry on, Mr. Doherty.
Mr. Chair, how much more time do I have?
Well, on my clock it says 2 minutes, but I'll give you 3.
Thank you, Mr. Chair. To our guests from the Canadian Trucking Alliance, you've been very complimentary with the government with response to the challenges that the trucking associations have faced. I've been in touch with many trucking associations across our country, which are fairly frustrated in terms of some of the response and the challenges that our truckers have faced along the ways. As you know, the federal carbon tax went up by 50% on April 1st. To an industry like yours, and given the situation that we find ourselves in, I know the impacts of this must be significant. Can you talk about the impact of the carbon tax on the trucking industry?
Mr. Lukowski, you're muted.
There we go, Mr. Chair. Thanks for reminding me. Getting used to this new system. I'm sure my wife would like the mute button. Thank you very much for the question. With regards to the carbon tax and relief measures in general, the Canadian Trucking Alliance put forward several different measures and options with regards to relief with regards to our industry. And it did include a freeze on the carbon tax from the March date over till April 1. As you're aware, and everyone on the committee is aware, the carbon tax did go up on April the 1st. So that was indeed a measure that we brought forward as a potential relief option. But by far the greatest measure and impact that we can have with regards to our industry, with regards to cash flow, and cash flow is the big issue, is the measure that we brought forward with regards to payroll taxes, which is a 3-month deferral with a 12 to 18-month payback. And then with regards to specific relief for truck drivers, obviously meals have gone up dramatically, whether you're across Canada or into the United States. And so with regards to that, what we're asking for is an increase in the meal allowance.
Mr. Kukowski, do you see, and I'm a former transportation guy, so I'm very well aware of the trucking, the labor shortages that we face within the trucking industry. Do you see COVID-19 hurting our opportunities to hire or growing this labor shortage?
You know, I'll answer it this way. I've never seen an increase in terms of the image of our industry for the betterment with regards to what it means to be a truck driver in Canada.
Right.
If you go to #ThankATrucker, you've seen an elevation, and deservingly so, in the general public's mind of what it means to work in our industry and to drive a truck and the importance of it. Our hope, and we will be working on it, I won't get into it on this call, but with regards to that esteem, maintaining that and attracting people to our sector. I mean, our sector, like all sectors in the economy, prior to COVID-19 and no doubt coming out of COVID-19, will be struggling to attract labor to it. So indeed, that is a question for us and one that we're working on.
Thank you, Mr. Doherty.
Thank you.
We go now to Mr. Van Bynen. Mr. Van Bynen, go ahead. 6 minutes, please.
Well, thank you, Mr. Chair, and I thank all of our witnesses for giving us the opportunity to hear directly from them during this busy and difficult time. I do want to start by asking questions of the Canadian manufacturers and exporters. In my riding, Newmarket Aurora, Magna International is one of the many Canadian businesses that have recently answered the government's industry mobilization call for action to retool their manufacturing and to help this fight against COVID-19. Has your association, and my question is to the Manufacturers Association, has your association received many questions about this call to action, and what types of businesses have been able to quickly retool their manufacturing lines in this short period of time?
Thank you for the question. Can you hear me okay, Mr. Chair?
Yep, Mr. Wilson.
Correct. So we've been working on this issue. Actually, we sit on, Mr. Laskowski earlier mentioned the Minister's Advisory Council on the pandemic response and supply chains. We've actually been working at CME on a similar committee to this that predates this by years. And we've been sitting on this committee and trying to provide information and advice to the government on how to stand up the manufacturing supply chain from the very, very early stages of this crisis. So we've been working on understanding what the needs are of governments, of the healthcare system, and of others, and then trying to help our members retool wherever possible. The retooling of a company like Magna, they have the size and scope and capacity to be able to do those types of things. Bombardier's done similar things. Linamar, GE, GM. There's a lot of companies who have done a lot of great things across the country. The problem tends to be with smaller companies who the big companies don't know who make the subcomponent parts, and so them trying to connect to other companies. So we would help a company like Magna. And in the case of Magna, I'm not sure we did specifically, but in cases like that, we've helped companies similar to Magna try to find sub-suppliers of some of the components that are necessary to make the finished products. Ventilators are complex components with probably thousands of different pieces in it. So that's where we played a role, is behind the scenes trying to connect companies together to make those products. And there's been companies from across the country who have been involved in this. One of our member companies, Dynamic Air Shelters from Mount Pearl, just outside of St. John's, is making shelters. There's Stanfields in Nova Scotia who are making gowns that used to make underwear and socks and things like that. Bombardier making face shields. We've got hockey equipment manufacturers making them as well. So there's a wide variety of companies who have switched production. I know in Ontario there's at least 350 companies. There's a group called the Trillium Manufacturing Network who has tracked that across the country. If Ontario's got 350, across the country there has to be thousands of companies who have switched their production into making these types of equipment.
Great, thank you. And what are your thoughts on the federal government support to date on these manufacturers?
The support actually has been fantastic. There is holes in some of the support programs, but things like the wage subsidy program, we were very early to call for that. And the reason why we called for those things was we saw the necessity of keeping people on the payroll rather than letting them go when there was a massive decline. That keeping them on the payroll allows them to switch production and make other things, but also allows them to quickly restart as the economy starts to re-go. So it was the things like the wage subsidy, things like the loan guarantees, tax deferrals, anything that kept cash in the pockets of the companies was essential because the liquidity was everything. So generally speaking, the partnership with the federal government has been outstanding. There are some problems with some of the programs, but generally speaking, it has been very good.
Thank you. And I'm concerned about the way we address or protect ourselves against foreign supply chains and our dependency on foreign supply chains. Any thoughts on how we might take steps to protect ourselves against that reliance? And the one example that rings very well with me is the fact that there were some masks that were stopped at the border. How do we protect ourselves against that type of risk?
Well, I think, I guess it was a good thing they were stopped and caught, right? We have regulatory standards for a reason. What I was worried about actually is that the regulatory standards would be loosened. And in times when people need protection the most, that they would have been loosened and things would have come into the country. So that didn't happen, which was good. But I think this is about, this isn't about do we have our own domestic supply chain. I think the conversations going down this road are a little bit dangerous. Canada, we long ago gave up the idea that we were our own unique economy. Starting back with the Auto Pact in the 60s, we started integrating with other economies, and it's been a huge advantage to our economy overall. All that trade that Mr. Laskowski was talking about, that's because of trade. I think the trick is making sure we understand where those supply chains are, who manufactures what, and where the weaknesses and vulnerabilities are in the supply chains. And that work really hasn't been done all that well at all. And when you find the weaknesses, then you can identify them. There needs to be duplicate supplies. You need to fill those holes by understanding those gaps, right? So that really is the trick. And right now we don't understand that. The other thing is we didn't really do a good job following 9/11 when initial stores were created to of PPE, for example, like N95 masks. We originally had pandemic planning that was in place following 9/11 and SARS, and most of those stores were never maintained. And so that was actually the bigger problem, is the governments didn't maintain the stores and keep them updated. And that was right across the country. It's more of a provincial issue than a federal issue, but that was a bigger problem probably than the foreign supply chains.
Great, thank you.
Thank you, Mr. Van Bynen.
Okay, thank you.
We go now to Mr. Theriault. Mr. Theriault, please go ahead, 6 minutes.
Merci, Monsieur.
Thank you, Mr. Chair. I hope that you can hear me well. I know that things have been challenging today. I would like to start by thanking the witnesses for your testimonies that allow us to see things more clearly, and that will also inspire us to have new measures so that we never have to have this kind of nightmare again. Madam Vice, in our long-term care homes, we've noticed a tendency from these testimonies up till now. The pandemic has shown us that our health systems are precarious, and this problem is structural and systemic. From the end of the 90s or mid-90s, federal governments shoved their deficits into the backyards of provinces and Quebec, and so we had to cut health transfers in an indecent fashion. And the result of that is that when we have to face a pandemic like the one we are facing now, the precarity, the fragility of our health systems is blowing up in our faces. And this is something that we all have to bear. How many people were sent without PPEs? How many, to date, have been infected? When we know that in Quebec, 80 to 87% of deaths happened in long-term care homes. Do you have any numbers regarding your members, your attendance?
We did, going back to the question posed earlier by Mr. Doherty, who was asking a similar question regarding the number of our members who have lacked sufficient or proper access to needed PPE in long-term care homes. The survey conducted in Manitoba included both long-term care and home care workers, and that survey was conducted in early April. The Public Health Agency of Canada released its guidance policy on infection prevention and control on April 11th. So it would be interesting for us to survey our members to determine more accurately if access to PPE for our members increased following the release of those guidelines, which mandated that homes should be providing our workers in the sector with adequate and proper PPE. At this point in time, unfortunately, I'm not able to provide an exact figure with respect to the exact numbers of workers who did not or continue to lack proper access to PPE, but I certainly agree that that data would be very helpful for us in terms of determining how we can prevent a situation like this from happening again. One issue that we do know that also has been very prominent is even in homes where staff have been provided with even a limited amount of PPE, many staff members have indicated that they're not receiving proper training on how to use the PPE, or they may not have been properly fitted for an N95 respirator.
Parlons-en. Parlons.
Let's talk about this, about training. There was a call for volunteering to help employees and attendants in long-term care homes. I don't know if you received wind of this, but certain testimonies stated that people were arriving and had to automatically become trained attendants with identical tasks to attendants who have been working for years. Did you get wind of these problems, that there was not enough training regarding this work and taking families out of long-term care homes? And is this something that should be repeated again next time?
So in response to your first question with respect to training, so I believe in both Quebec, definitely in Ontario, the government issued an order that allowed long-term care homes to essentially hire people off the street in order to fill staffing gaps in homes across the province. At this point in time, I don't know how many people have been hired through these avenues. So folks who have been hired off the street who have no previous experience or training related to work in the long-term care sector. However, even when the order was issued, our alarm bells were ringing very loudly. This is extremely concerning because the work of care aides is highly skilled. When you're working with a population who many individuals have dementia, so they can't communicate effectively what their needs are. You have individuals who have difficulty swallowing and need assistance with feeding. You need to know how to transfer individuals from a bed or wheelchair using a mechanical lift into a bathtub, or from a chair into bed, or vice versa. These are highly skilled tasks, and the thought that someone could be hired just off the street or simply volunteer their services, as altruistic as and well-intended as they may be, the risk to quality of care to patients is very high and very alarming. With respect,
just wrap up quickly.
Sorry, with respect to the second question related to should families be removing their loved ones from a long-term care home, for most people, this is not a realistic option because they don't have the skills required to provide the necessary care to their family member.
Thank you, Mr. Theriault. We go now to Mr. Davies. Mr. Davies, please go ahead. 6 minutes.
Mr. Chair, before you start my time, would you please clarify whether Ms. Black is available to answer questions?
Ms. Black has a new headset, I understand. We can always try. So please go ahead.
Okay, thank you. Well, I'll address my first question then to Ms. Weiss. You commented, Ms. Weiss, that the benchmark for quality long-term care is 4.1 hours of hands-on care per resident per day. And if I understand your testimony correctly, no provinces or territories are meeting that standard. Am I correct in that?
That is correct. Some provinces have no legislation regarding standardized hours of care. Some provinces, including your own province, BC, has a guideline that homes can aspire to. Other homes do have a legislative minimum requirement. It ranges from 1.9 to 3.8 hours across Canada, but no province is meeting the recommended standard of 4.1 hours.
I'm wondering if you have the current average number of hours of hands-on care that is being delivered. Do you have an estimate of that?
So this question is actually extremely difficult to answer. The answer would vary by province, and one of the reasons why it is so difficult to answer is because some provinces will calculate hours of care based on funded hours of care. And other provinces will calculate hours of care and include in that calculation time that is not related to directly worked hands-on care. So the time may include staff's vacation time or paid leave. So it doesn't reflect worked hours.
And can you give us a ballpark idea of what percentage of workers in long-term care facilities in Canada would be working under collective agreement?
Oh, that is a very good question. And I do not have an answer to that question, but I will be happy to look it up and send it to you.
Thank you. You've painted, quite frankly, a shocking picture that I think is one that Canadians have recently become more aware of. You know, the idea of picturing our parents and grandparents, great-grandparents, seniors in homes that are skipping their weekly bath. These folks that are being left in soiled clothing for hours and not getting the attention that they need, I think is just really appalling. I know that recently the federal government published some non-binding guidelines to reduce the spread of infections in these facilities. Can you basically describe those and let us know if you feel they're adequate and if they should be made permanent?
So there's two parts to that question. So the federal government, the PHESA guidelines, when they were released, and I gave them a quick review, most of the key guidelines that were recommended were measures that all provinces essentially had already undertaken. And this includes limiting access to facilities to visitors, ensuring that PPE is available in homes. And so during any kind of outbreak, those are typical measures that a long-term care home would implement. They are things that will need to continue should a situation like this arise again, most certainly. The other thing that some provinces have done, so BC, Alberta, Manitoba, Saskatchewan, Ontario and Newfoundland have implemented single worksite orders. And so this limits workers in the long-term care sector to employment in only one long-term care home. There are some employee groups that are excluded from these measures, and that would include some agency workers. So that means that agency workers can still move between multiple sites, and also hospital workers. So some hospital workers are being redeployed to work in the long-term care sector. And so they can work a shift one day in the hospital, return to a long-term care home the next day, and then return to the hospital the next day. So
well,
we're not.
If I can just break in, I'd like to turn to Ms. Black because you've anticipated where I'm going. BC is taking a different approach to single site orders than other provinces. Can you describe, Ms. Black, how that's working?
Yeah, sure. So I think one of the key differences, I would say, because I am in regular contact with colleagues across the country from QP, is that our effort has been fairly well coordinated, considering, with a few glitches, and couldn't say that about the other provinces. And it involved a very strong consultation with labor unions. So we were in from the ground. We established a set of principles that would be applied to how workers would be allocated to different sites. Employers and unions essentially negotiated a labor adjustment process. And then that was turned into a ministerial order to ensure that all operators, not just the public facilities, but the privates would be included in that as well. And so it applies to long-term care, assisted living, and mental health facilities. And workers who normally, the situation that Ms. Weiss described, of workers holding 2 and 3 jobs sometimes in long-term care, of course, is true in BC as well. So we're also trying to avoid the unintentional cross-contamination that might come with it. That's the intention of the orders. So long-term care workers, assisted living, and mental health facility workers are prevented from holding another job within those facilities, but they can hold one in acute care or community care. So they're not prevented from earning their income in that sense. There's some protection with respect to seniority in terms of scheduling of hours, protection of benefits that come from one of the set of orders as well. And the key, of course, is that we achieve wage parity. So you're not penalized in having to stay at one site where you're normally been able to work a second site. You will get something comparable to the total hours that you held in both sites. So it, in the SARS crisis in Ontario, in particular, there was a very clear exodus of nursing staff from the lower paying employers to the higher paying employers. Agency staff, surprisingly to me, were some of the highest paid, and they were moving between sites. So in BC, agency staff are not excluded from the orders. But just to say, that pattern in Ontario during SARS was very clear that some facilities were very short-staffed that weren't paying as well. So with the leveling up of wages, there's no disparities that way. It's all the same no matter where you go. And they've done a fairly coordinated effort with these 3 sets of orders that work in tandem, that work to lay out principles and how staff are going to be allocated, but also get into the logistics of allocation instead of saying, go ahead, folks, try, because that hasn't fared well in the other provinces. It hasn't materialized. But in BC, it is. It's going relatively smoothly. There's a very clear process with the health authorities. There is a set of lists, from employers within a health authority that are given to the chief medical officer, who then sets ultimate approval as to staff assignment. Workers' collective agreements aren't thrown out the window, so they're relatively content and satisfied with the situation. And it's ironically, now we're in this situation where there is parity and people are receiving this public sector standard that we had in 2001. Virtually all workers in long-term care made the same wage. All care aides rather. It's certainly something that we think is critical to stabilizing this sector. There has to be wage stability. There has to be a common standard set. It's the only way you're not going to end up with that misallocation and those big disparities. And our members and the workers deserve it, frankly. I mean, we're calling them heroes at this point. Got to put our money where our mouths are.
Thank you. Thank you, Mr. Davies. That brings an end to round 1. We will start round 2 with Dr. Kitchen. Dr. Kitchen, please go ahead. 5 minutes.
Thank you, Mr. Chair, and thank you, everybody, for your presentations. As always, they're very enlightening and educational for us all in many different aspects as we deal with this crisis. I'm going to start with Mr. Wilson. And Mr. Wilson, you indicated that you've been working on increasing your manufacture and supply of PPE, and you also indicated that many companies have applied to make changes, and obviously it's an extremely costly event to take a company and change a produce line or whatever it may be. And I'm just wondering, do you know how many companies have actually applied to the federal government for funding and actually got contracts to come forward with the PPE?
To be honest, I really don't know how many. I apologize. I wouldn't even know where. I would assume someone inside public procurement would know, but I just don't know. I apologize.
Would you be able to find that out from your point of view and from your side and provide that for the committee?
We could try to find out just through our membership. Yeah,
great.
Absolutely.
Thank you. Appreciate that. Mr. Wilson, the CME has a pandemic plan. It developed after SARS in 2009, and it's a great document, 40 pages and quite a lot of extensive information in it. And I'm interested to know, how fresh was this document on people's minds, on your company's minds? Were they aware of this, or did this just basically get done in 2009 and we forgot about it?
Yeah, the latter, unfortunately. It was done in 2009, and I think for a year or so it stayed fresh in everyone's mind, and then it disappeared. That was at the time the most downloaded document in the history of our organization's website, and I think now we've surpassed it with some of the COVID-19 information. Back in 09 and 10, when that was first produced, that was the highest downloaded document in our history. So, but I think we forgot about it. Governments forgot about it. It wasn't. I'm not going to point the fingers at government, certainly, because I think we forgot about it as well.
Right,
and I tried to refresh it.
I appreciate that, because part of what we're seeing is after 2003, after SARS, basically the same type of document was done, and it appears that it basically just was forgotten about. They came up with plans, but it was just pushed aside. And it's interesting to hear that's part of what you found with you as well. Thank you very much for that, Mr. Laskowski. I live in Estevan, Saskatchewan, which is right on the border of the United States, and we have a major trade corridor. And trucking trade corridor, basically Highway 39 from the border up to Regina, and then number 1 across Canada, as well as Highway 52 coming out of Minot and out of the States. And so we have a lot of trucks coming to the border. And as you've indicated, and as I've seen between April 20th and 26th, that the trucking is decreased by 33% as it's coming across. And that's quite significant. On Wednesday, December 29th, the Federal Motor Carrier Safety Administration published an updated list of distribution locations where truckers can receive free protective masks. In all, the agency said it plans to give out about 1 million masks. Do we have such a situation here in Canada? And if so, how do our truckers access that? Sorry, you're on mute.
Sorry about that. Okay, here we go. I'm a slow learner. So with regards to the access to masks and other equipment, from a trucking industry perspective, and from, quite frankly, every sectoral perspective, it's a challenge. It doesn't mean that challenge isn't being met, but it's a challenge. In particularly, gloves aren't necessarily the big issue. Masks, depending on the quality of mask or the type of mask specifically, can be a challenge, as can be hand sanitizer. With regards to specific government action at the federal level, CBSA is trying to secure masks for every truck driver that shows up to the border not wearing a face covering. So that's very much appreciated. Obviously, that's a short-term measure. And that's why this committee has been struck at the federal level of how we can, as a supply chain, not just trucking, but everyone, can secure those masks going forward. Not just secure them. Obviously, there's been some folks in the supply chain, and you've heard the federal governments and various premiers go out against price gouging. And I can tell you, we've experienced that price gouging. A typical mask at the highest quality should pre-COVID-19 would cost around $2 a mask. You can get upwards of $15 to $20 a mask now. And so there are challenges, but as I said, we're working through them.
Right, and I saw
Thank you, Dr. Kitchen.
Thank you.
Mr. Fisher, we go ahead with you now. 5 minutes, please.
Thank you very much, Mr. Chair, and thanks, folks, for being here and sharing your expertise with us. My first question is going to be for Mr. Lemaire. First off, thank you for the critical service that your members do for Canada. All sectors have been impacted by COVID-19, certainly none more than yours. How have your members and your sector adjusted to all of the various public health measures, social distancing, etc.? And I was going to ask you how government could help. And I know that during this meeting, the Prime Minister has announced $252 million for certainly much of your sector. So maybe you could speak to your thoughts on that. I don't know how much you've been briefed on that as that happened while we are here in committee. I'm sure you've got a computer open or your phone open there and you're getting some details on that. So I thought maybe you would chat a little bit about how you've been impacted, how your sector's been affected, and how this government assistance might help.
Thank you for the question. It's been a very interesting time, and what's been amazing is that the industry has pivoted throughout the supply chain. So CPMA represents growers through to wholesalers, transportation, logistics, as well as food service and retail. So everyone who's gone shopping has seen the strategies implemented at retail to enable volume of shoppers in store and or social distance requirements, flow of traffic through the retail outlets, regardless of size. So that's been very effective. Added cost with the shields at checkout, and in some cases, other protective equipment. Going back to look at the food service industry, that's going to be a very different environment. Checkout has been successful on enabling social distancing through drive-through windows and pickup orders. Looking at the wholesale community, the Toronto Food Terminal and other wholesale markets in Vancouver and Toronto and Montreal, this is a real challenge relative to fresh fruit and vegetables. It's a perishable item. The purchase program and modeling is normally done where you look at the product, you see the product, quality and freshness is key for the supply chain. So how do you create an environment where the buyers can come with the appropriate personal protective equipment into the purchase environment, maintaining social distancing and still be able to purchase the product they can use within their retail outlets from small independent grocers throughout the country. On the fresh cut and processing side, so this is perhaps the biggest challenge from there back to the grower, where you look at how do you social distance, similar to meat plants and other facilities where you repack fruit and veg and or work in a fresh cut environment, an apple packing line. How do you manage that and still put volume out to meet market demand? That's been the greatest challenge in spreading out the line. Volume has dropped. How we can create the appropriate guidelines and standards, leveraging personal protective equipment to enable the social distancing model to be shrunk slightly, or some type of barriers is something the industry is looking at. But again, varying across the country on municipal application, how the rules are applied and regulated. Going to the grower side, the challenge now goes into how do growers actually apply pest management products and other tools in the field, and do they have enough personal protective equipment for their farm workers when they are in the field working and either planting and eventually harvesting. The funding that's come out, the $252 million from the federal government, is greatly appreciated. The breakdown of those monies, the $50 million is of interest. Curious to see how that will work relative to surplus. We've often talked to the federal government about those funds specifically because it's modeled used to the U.S. successfully. And how do you take surplus product, which I talk to, and distribute to insecure populations or at-risk populations or other channels is key. Now the next step will be, how do we do that?
Yeah, you talked about the food service sector, the drive-through sector, and MP Van Bynen asked a couple of my questions of Matthew. Mr. Wilson. And I love the fact that the call to action, the call to retooling Canadian business, and there's nothing more creative than Canadian business. Mm-hmm. And Matthew, you spoke to a couple examples, and I spoke with a company in Dartmouth Cole Harbour who is building templates for fast food drive-throughs to more safely deliver the food through the drive-through window to the car. So it's incredible. I guess if I have probably very little time, but Mr. Chair, I would ask a last question. Post-COVID, and I'll ask Matthew Wilson, post-COVID, this retooling, what does this do for the future of manufacturing in Canada? Will we continue along this road as more of a manufacturing presence after COVID?
Well, I'd say another good example is window manufacturers making the protective barriers as well. I know a number of our members out west, for example, are doing that type of thing too. So there's a lot of them. And I got an answer too, by the way, 3,500 manufacturers went to ISED directly for support. I think that was the last question I was answering. And 250 of them came through CME, where we tried to connect people into government support programs. So directly for retooling. So that's a pretty big number of companies. And those are just the ones we know about. What's going to happen in the future is going to be really interesting. Look, the bottom line is we won't need this level of production of these types of products on a go forward basis. So there will be most companies, what we would expect when things go back to normal. A window manufacturer, for example, will go back to making windows when the housing market starts to heat up again, right? So a lot of companies are doing this shift in production. Magna making ventilators or Linamar making ventilators, they're not making any parts, so it makes sense for them to do it. And a lot of them stepped up, not with any government money, but just because they wanted to respond. Most of those companies will go back to making what they were making before. But there are opportunities. As I said, I mentioned the idea of a DARPA for healthcare in Canada. There are huge opportunities in Canada to manufacture healthcare-related products, become experts in that, and export those products around the world, as well as supply domestic demand. So I think there's huge opportunities for us if we focus on it and look at where the opportunities really lie and support those industries who want to grow.
Thank you, Mr. Fisher. We go now to Mr. Weber. Mr. Weber, go ahead, 5 minutes.
Okay, thank you, Mr. Chair. Again, I've dropped off about 4 times in this meeting, so if I do drop off here, I will pass it on to my colleague, Tamara Jansen. Question to the Canadian Trucking Alliance, Mr. Laskowski. Are we aware of any Canadian truckers who have caught the virus as a result of their work down in the United States?
Mr. Lakowski, you're...
I've unmuted. With regards to that specific, we've had no members report that directly to me, no. Great,
because we know that these truckers are being asked to travel down there, and the infection rates down there are the worst in the world. So how are they finding safe access to accommodation and meals and bathrooms, et cetera, down there in the States? I suspect that they're not able to practice infection control measures at the level we'd like to see, but they are not quarantining upon their return here to Canada, as we understand. So is that not a serious threat here in Canada?
So I'll back up in terms of the life of a truck driver. Sure. I think as one owner operator explained to me with regards to exposure, obviously they are going into areas, whether it's in the United States or Canada, where there may be more breakouts. But in a normal week, a truck driver may only encounter 6 or 7 people. It's a job that's pretty isolationist. You're in a truck by yourself, and make no bones about it. Both the drivers and the industry, our industry, and our customers are taking COVID responses very seriously with regards to practices. So we are doing our best job to protect our workers, as are our customers. With regards to access to food, that is a challenge. And that is why, and when you do find it, for example, a bottle of water that used to cost $1 costs $4. And that's just a small example. That's why we're asking for an increase in the meal allowance. There's currently a meal allowance allowed in Canada for truck drivers on their taxes. And what we're asking the government of Canada to do in light of the dramatic increase in food costs on the road to increase those meal allowances.
Oh boy. Okay, I just froze there. I didn't even get that answer, Mr. Laskowski. So here's the problem already. So I will just continue on here then. I guess this can go out to any of our witnesses here, but we know that many Canadians are looking for work now because of this crisis. And have you heard of any, of course you have, labor shortages with your stakeholders? Is there an opportunity right now here to highlight employment opportunities for Canadians looking for work with your associations? Mr. Laskowski, in the trucking industry, are there a lot of opportunities now for truckers to become a trucker?
I would think once we emerge from COVID, the answer is yes, because prior to COVID, the answer was yes. But the reality again is, and I don't want it to continually to go back to this, we're down substantially. A lot of people think that trucking companies are going full bore, and they may in certain lanes. But we're down 30-35%. And that means that trucks are parked, and that means in certain segments of our economy, truck drivers are at home because there's not work for them. So the overall message is we're an industry that's working to move the supply chain, but like other sectors, like those in the food industry that received help, we're going to need some specific help as well.
Yeah. How about the Union of Public Employees? I'm sure there's quite a demand right now for healthcare workers, although it is very risky to be working in a long-term care facility right now. Is there a huge demand?
There is, but the demand for workers has been exacerbated by the pandemic. The sector was long desperate for workers before the onset of COVID-19 across the country in every province.
Right. Just back to Mr. Leskowski again about the truckers. Regarding the training involved with respect to being prepared for this COVID, and what type of training is out there for truckers, and with regard to protecting themselves from this virus?
You know, in my opening comments, I mentioned the fact that the government of Canada really stepped up, and here's an example: both Health Canada, Transport Canada, working with our membership, and those that are unionized, working with their labor representatives, have really worked together with regards to how to make this a safer supply chain. And as Matt can attest to, their members, how they interact with our industry. So it really is a great time to, out of all this bad, this has really been an example of great teamwork within the supply chain, both in the private sector and in the public sector. You know, we can always continue to improve, but everyone has stepped up and everyone is doing their part.
Thank you, Mr. Weber. We go now to Dr. Jaczek. Dr. Jaczek, please go ahead, 5 minutes.
Thank you, Chair. And first of all, I would like to thank all of our witnesses today. You've been very specific in your recommendations, and I really appreciate that. I'm sure that each of you will be continuing your dialogue with the various ministries you interact with. And I certainly think that the type of coordination and collaboration that we're hearing of is very, very positive. So my first question is for Mr. Lemaire. Mr. Lemaire, you mentioned the issue of temporary foreign workers. And I think we've all become very aware of the importance of these individuals. In my former life as the medical officer of Health for York Region, under provincial guidelines, we would go in and we would ensure that living accommodation was consistent with good practice and so on. You mentioned a lack of consistency now being an issue across Canada given the COVID-19 situation. Could you just elaborate a little bit more as to what you actually meant about that and what difficulties that's causing?
Most definitely. A simple example is in Ontario, where you see one county or municipality who has a very rigid protocol requiring, to your point, bunkhouses and a certain square footage of bunkhouse that could only maintain a number of 4 workers. You go to a 5-minute drive over the road to another county, another municipality, and that same bunkhouse size can hold up to 10. It is literally a kilometer or 2 down the road. Those inconsistencies create havoc and added costs and structure and strain to a market and a very stressful environment for a grower who's trying to manage the best case scenario for workers who have been coming to their farms for many, many years and are really, in some cases, part of their family. So they have tried to leverage hotel rooms if they're available close by, added costs. The funding that has been provided by the federal government of $1,500 per worker has helped, but it's still not enough to offset the total cost of isolation. So how do we look at consistency? Well, Public Health Agency of Canada did provide guidance and direction, and recognizing that the federal approach is that the boots on the ground or regional level has a better understanding of how those regions need to operate. There still needs to be more discussion at the FedProv territorial level to ensure provinces can take a more effective lead to harmonize an approach, at least across a province, to enable let's call it a consistent healthy, safe, and competitive world for the farmers. And I'll give you an example right now. The challenge they're seeing is we have 85% of the workers we would normally have at this time. But that's 85% of a total that was already short last year. So we actually have a greater shortage to the actual number of workers we need. So by adding protocols and restrictions that may be over and above the requirements that even the Public Health Agency of Canada have identified, is just creating more of a strain on access to Canadian food, putting the workers into the field if they are not showing symptoms. There have been some discussions about, they're isolated on a farm. Can you just take that isolated group and have them working within an isolated environment? So a range of discussions have been proposed, but we do recognize that some of the direction from public health is most definitely warranted.
So in other words, you're thinking of a bit of a stronger guidance role for the Public Health Agency of Canada, even beyond this pandemic. You would like to see sort of more consistency across the country. Is that essentially what you're saying?
Harmonized approach, and also a review of the protocols as well. Again, every work environment is different, and we've seen that in some of the discussions relative to packing, meat packing, produce packing lines, your retail environment, your grower environment. And not every work environment is the same, and we recognize those protocols need to be adapted. But we also have to recognize what is the risk in some of these protocols, and do we need to have that same level of stringency on lower risk environments for spread.
You made some reference, Mr. Lemaire, to some increased flexibility that CFIA has introduced around labeling and so on. What are some of those measures that you would like to see post-COVID-19 maintained?
So what is important right now is that if we have a product that was perhaps destined for the U.S. market, Canadian product that had U.S. labeling on the package, we need to ensure that the allergens and all of the correct information to ensure the safety of Canadians is on that package. At the same time, though, Canadian consumers are smart. As long as the information is there, even if it's not in the same format that they're traditionally used to, they will be able to navigate that package, and we will be able to service and provide food in gaps for the Canadian market. So the flexibility on consumer packaged goods and consumer food packaging is essential to making sure we don't have a product that's sitting in Canada, not moving to the US because of other issues that could easily be redirected to Canadian consumers without, again, adding costs of unpacking and repacking that product in a Canadian label. So the flexibility is key. CFIA is looking at how they can adjust those requirements, and we have provided recommendations to that. I'm happy to share those with the committee.
Thank you, Dr. Jaksic. We go now to Mr. Thériault. Mr. Thériault, 2 minutes and a half, please.
The interpreter gets, but she cannot hear.
Can't hear you.
Le sous-financement du système.
Underfunding of the health system. This created precarious situation in long-term care homes. Earlier, you mentioned that there would be a significant increase in needs in long-term care facilities. What would be the best approach to take on this issue? Do you believe that at-home care could help respond to this increase? And had there been at-home care services that were well put in place with properly trained staff, do you believe that we would have noticed the same situations in these long-term care homes through this pandemic?
Yeah, to answer that question, I don't think the answer would be an either or type of situation. there was a recent study published that came out of Ontario that polled individuals who were in hospital but could not yet return home, but because they couldn't live completely independently without some supports in place, but also did not require the level of care that's provided in a long-term care home. So the majority of individuals in that poll indicated that what they would like to see in Ontario is an increase in access to home care services. I believe that we need both. I believe that we need more funding for home care services. I believe that home care should be publicly funded and publicly provided at the same time that we increase the number of beds in long-term care, because we do know that the size of the aging population is going to grow quite rapidly over the next couple of decades.
Présentement,
do you believe that we could safely reintroduce a person with seniors who are currently dying alone in long-term care facilities? Now that we have PPE, I imagine that perhaps it could be a good idea to allow one important person to that senior to go into the long-term care facility so that our grandmothers and grandfathers don't have to die alone in these long-term care facilities.
This is actually already taking place. So homes, the administration has the opportunity to assess each individual case and determine whether it is safe to allow one family member into the home to visit with someone who is dying. So in some provinces, this is permitted, and I believe if family members are provided with proper PPE, that this could be something that could be slowly reintroduced to ensure that no resident living in long-term care dies alone.
Thank you, Mr. Theriault. We go now to Mr. Davies. Mr. Davies, please go ahead. 2.5 minutes, please.
Thank you, Mr. Chair. Ms. Black, we heard the, I think, rather startling statistic of some care homes having patient attendant ratio of 1 to 75 at night, which is, almost unfathomable to me, considering the risk to the population that we have. I'm wondering how far off most long-term care facilities are from having the level of staffing that would be considered necessary and adequate.
Sure. So as Ms. Weiss said earlier, it's hard to know across the country, given the way that staffing levels are collected and reported, exactly how far off we are. I can give you the example of BC. We have a guideline of 3.36 hours per resident per day. On average, they're being funded for about 3.25 in BC right now. And that figure, to note, when Ms. Weiss spoke about the 4.1 figure that was recommended out of what's the most comprehensive study to date, it was a report to the US Senate, but it's 2001. I mean, the complexity levels of seniors have increased radically since 2001. So it needs to be updated. We need a revamp. But the complexity of that study, I mean, it looked at over 5,000 facilities in the US receiving Medicaid funding. It used regression analysis. It used extensive modeling following care aides and staff around to see what length of time, like time motion studies. They used hundreds of key informant interviews with directors of care, with head administration, with care aides. So just to say, it's hard to replicate a study like that. So we do rely on that old figure. And just to say, the number needs to be revamped. And undoubtedly, it's going to be higher than 4.1 when we go to do that. right now, so in BC, the 3.36 guideline is obviously falls shy of that 4.1 figure. The 4.1 figure in that study refers to direct care hours. So the nursing team, the care aide, the licensed practical nurse, the RN. In BC, the 3.36 guideline includes allied health. So your dietitians, your occupational therapists, all essential and necessary. But just to say, in a way, it's like padding the number. If you get down to the direct care hours, it's even lower than 3.36. And as I mentioned, we're not hitting it right now. The average is 3.25. So there's certainly a gap.
Okay, if I could just turn you quickly to the issue of PPEs. What is the situation of PPEs in care homes in British Columbia, and what did we learn from this pandemic on a going forward basis?
Yeah, we have members that are going without at this point. Our members are they're fearful. We've certainly at this point we're being assured by our medical health officer, who's doing an incredible job, that we have 3 to 5 days supply on hand. And as Ms. Weiss said earlier, there is a sort of hierarchy of the doling out of the PPE. It's the same in BC. It goes to acute care first, and then to long-term care, and then home care and community. So we're facing that situation as well. And I think, a lesson to take from it is that there has to be an adequate supply up front. We've got to make sure that it's stored, that we have that on hand for our members. So there isn't this, it's creating divisions on the team. It's like ultimately nurses are being given this equipment, but not necessarily other people who are in direct contact with the patients. We can't be in that situation again. It's not a time when you want the team to be divided, and you want ultimately for the workers to be safe.
Thank you, Mr. Davies. We go now, we start round 3. Ms. Jansen, please go ahead, 5 minutes.
Thank you. I wanted to start out by thanking everybody for being here. And I thought I'd maybe begin with Ms. Black. Your presentation suggested that public long-term care facilities, so public facilities, are having a much better result in combating COVID-19 compared to other facilities. However, I'm not sure that that's correct. I thought that we would see similar infection rates in both private and public long-term care facilities. Interestingly enough, just down the road from me is a private senior care facility that, I'm in BC, that felt compelled to ban those healthcare workers being sent to their location, in part because the local health authority had only assigned 2 face masks and 2 sets of gloves for the month to those care workers. So clearly, this sort of PPE rationing is dangerous, not only for patients, but also for care workers. Now, you seem to be suggesting that making all long-term care public is the main solution to the problems that we're facing, as opposed to, the lack of PPE being available. Would new national care standards that apply to both private and public facilities, as well as ensuring adequate PPE supply is available, not go a long way to solving a lot of the challenges facing long-term care across Canada? Yes or no?
PPE having adequate supplies would absolutely be helpful. But the reason why you have the potential for cross-contamination, and the reason why one of the key steps all provinces are considering implementing or have started to implement at this point, is the single site orders. And that's about making sure that workers don't have to work in more than one facility.
Right. So that can be done via also in private. Those standards, I think that's a wonderful suggestion. Obviously, it's working here in BC, and those standards obviously could apply to both private and public. So awesome. I appreciate that answer. Now, because my time is really limited, I wonder if I could go to Mr. Lemaire. And first of all, I'm so glad to hear that the government's finally announced support for farmers, because as a farmer myself, it has been utterly heartbreaking to watch the despair my farm friends have been experiencing as they face the impending bankruptcy for the last few months. It's been hard, and I do pray that this will not turn out to be too little too late for this industry. Now, due to COVID-19, the government has shut down business across country, and the consequences of this forced shutdown is the need for government to replace lost incomes. these programs are designed to encourage people to stay home, which during a pandemic is a really good thing. With the current situation of disincentivization, how should the government how should the government adapt these programs as we get this country back up and running to encourage workers to go back to work? I think especially in the farming industry.
That's a great question, and not only for the farming industry, but right across the supply chain. But looking at farms and looking at how the farmers operate, right now, if we go to BC as an example, there is a large group of hospitality opportunity because the hospitality sector and their employee base are leveraging CERB. They traditionally could be an option to move into some of the farming community to help with production and or picking and so on. It is a disincentive relative to I'm staying home, getting my money, and I'll look at the future down the road. As I mentioned, the mental health component, that's going to be our bigger challenge, is taking out the actual cash incentive. The combination of cash incentive and creating a safe environment is fundamental. So the combination of protocols and rules that are in place in the transitioning and reopening of the economy at provincial and federal levels, how do we ensure we have the appropriate protocols and personal protective equipment so workers feel comfortable about applying for jobs and going back to work?
Absolutely. No, I appreciate that. I guess what I'm hoping, like when I look at, for instance, the CERB program offering $2,000 if you're not working to COVID-19. However, if your employer calls you into work and you get the $1,000, suddenly you aren't necessarily going to want to go back in because you're going to lose your CERB. So I'm just wondering, do you think this is going to cause problems for employers being able to find willing workers when the time comes? And I'm specifically thinking of fruit harvest that's going to be coming up soon. And we have CERB student benefits that are going to last well into August.
Yeah, and the student benefit we'll have to wait and see, but it has potential to cause challenges for that workforce that potentially would be coming in on seasonal work. So time will tell. The question is going to come in, does the government need to put in some type of added wage incentive that industry can use to leverage, similar to what we heard through on the trucking side on how do you support on the meal and tax reduction. Likewise, on the employer side, is there other incentives that the employer can use to leverage and provide more of a cash incentive for these people to come off of social programs?
Now you've mentioned...
Thank you, Ms. Jansen. Thank you. We go now to Mr. Kellaway. Mr. Kellaway, 5 minutes.
Thanks so much, Mr. Chair, and hello to the colleagues out there and to the witnesses. It's a real privilege, actually, to talk to you today. My questions are going to be focused on our witnesses from CUPE. My riding of Cape Breton-Canso is home to many local CUPE groups, and I know how hard you are working for Canadians at this time, and just want to give you my and my family a heartfelt thank you for all that you're doing. Many workplaces have been adapted to the new normal where possible to protect their employees, and you've talked a little bit about that. What are you hearing from your members when it comes to measures being taken to adapt to this new normal, specifically in the context of frontline and primary healthcare?
So with respect to some of the key changes we're seeing in provinces that have instituted single work site orders, there is a concern among members because we mentioned earlier that our members work multiple jobs at multiple sites. We need an assurance for our members that when they are restricted to employment at a single work site, that they will receive an equivalent number of hours so that they don't lose pay. Another major concern of our members, they're absolutely terrified of taking the virus home to their family members. and prior to instituting the single worksite orders, because also not all provinces have them in place, workers are also very fearful of contracting the virus, not knowing it, since many individuals who have the virus are asymptomatic and potentially transmitting it to residents in the sites where they work.
Mm-hmm. And your counterpart, anything to add to that?
I think our members, I mean, the other piece in terms of the new normal, maybe not quite as directly related to their work, but you know, the lineups in grocery stores, the transportation trying to get to and from work, the issue of laundry. Previously, you could get scrubs at the hospital. Now they're not able to. So it's like there needs to be something, some allowance, some provisions to help with meals, with transportation. We're also seeing public transit cuts here in BC simultaneous, and they haven't avoided all healthcare institutions. There are, I think, some kind of allowance and provisions to help members with their, you know, maintaining some balance of life outside of work as well.
Interesting. I want to touch upon a particular theme in this discussion and this round of questioning, or the first two rounds of questioning, around wages and providing, you know, better wages for those that are working in long-term healthcare. And I've had some experience working in long-term healthcare, being in charge of training and development for the Nova Scotia Community College. A lot of CCAs and PCWs and LPNs went through many of our programs. So in terms of the top-up that was announced a couple of weeks ago, the provinces and the federal government working together on that, I'm wondering if you had 5 minutes to talk to both provincial representation and federal representation. What recommendations would you give the government in terms of how to implement the wage top-up? Thank you.
I'm sorry, is that directed at me or
that would I'm still staying with CUPE. I'm just focused just on you two. At the middle square and the far left square on Hollywood Squares there.
Amanda, I'll let you go ahead.
Thank you. So the wage top-up certainly has been welcomed by many of our members. One thing that, of course, they would like to see, that the wage top-up is not only a temporary measure, that it is a measure that remains in place as things start to settle down and life returns to a new normal. One thing that we were seeing is that the wage top-up in some provinces has been applied equally across the board for all job classifications who are receiving the wage top-up. However, because in particular care aides and workers in the long-term care sector are comparatively so much lower paid than workers in other sectors, the top-up still doesn't really make up for the inequity in terms of the wages that they had been receiving.
Thank you, Mr. Kellaway.
Thank you very much. Appreciate it.
We go now to Mr. Doherty. Mr. Doherty, please go ahead. You have 5 minutes.
Thanks, Mr. Chair. Mr. Wilson, we have a container shortage, especially the 20-foot equivalents due to the clawback of Asian exports. There is a drawback in the containers coming into Canada and many missed sailings. How do we manage this situation so when the economy trickles back, we have containers for exports and the ship lines have protocols in place to ensure and avoid a COVID outbreak, or at least we can contain it?
Well, I think there's two issues there, right? It's the supply of the equipment and making sure that there's safe protocols in place on the equipment itself. I would actually look at this similar to the way we looked at, say, the CN rail strike. Not that many, it seems like forever ago now. It was just a couple of months ago. But exactly the same problem happened, right? You couldn't get the equipment to where the goods were needed to be moved to and from.
Right.
And it takes a long time to undo that. In fact, I think that in the case of the CN rail strike, it was going to take in the neighborhood of 4 to 6 weeks for
Pardon me,
complete
Mr.
unraveling.
Wilson. Your sound quality is not good. Could you try and speak carefully into your mic?
Sure. Is this better?
Yes, let's try that.
Okay. So it'll be very similar to the unclogging after the CN rail strike, which will take 4 to 6 weeks at minimum. And in this case, might take longer because of the global supply chains into Asia and other things like that. So that piece in and of itself is not going to be easy. And it will trickle over into not just the containers that are on ocean vessels, but also into the rail system and the trucking system, everything.
Right.
As far as the safe handling goes, I think there are protocols that are already put in place. I know we put out guides on safe material handling. I think we're working really closely. Our members are working really closely with trucking industry and others to make sure that's out there. So there are cleaning protocols and that in place.
Okay.
And so I think it'll be well handled. Just take a long time to undo.
Right. Mr. Lukowski, in the last few weeks, we've received several calls from owner-operators that have been parked or given no work or have been laid off, and in some instances, their contracts have been canceled. This is going to create a major problem. They won't be able to pay for insurance coverage for their equipment, won't be able to make truck payments, won't be able to make mortgage payments. Have you encountered any owner-operators that have had similar problems or that have slipped through the cracks in terms of the federal measures presented? You're on mute.
There we go. With regards to the pain being felt by small companies, owner-operators, as you mentioned, but that pain is being felt throughout the trucking supply chain, both big and small. So, as our customers suffer, the trucking industry suffers. So it's not just specific size, it's what sector of the economy you're tied to in the trucking industry. And we're tied to all sectors. So it really depends on your customer base. As I mentioned before, CTA has complimented the government of Canada for the measures they've introduced. We've introduced several specific measures for our sector that have been supported by the Owner Operators Association as measures that will help, obviously, small carriers, owner operators, as you mentioned, and also carriers of all sizes.
Mr. Chair, how much time do I have?
You have 2 minutes.
I'm going to turn it over to Dr. Kitchen for a question, please.
Go ahead, Dr. Kitchen.
Thank you, Mr. Chair. And I just had a question, actually, and I really appreciate Ms. Weiss and Ms. Black. And you presented a number of issues that you would like to have seen happen. And I'm interested to hear from you, because you've talked about cross-contamination that we're seeing with the long-term care facilities. You've talked about how we've moved from where the worker only goes into one facility now instead of multiple facilities. And I'm interested to know, I mean, in my practice and in many years, and my wife's a nurse, and she's actually a long-term care nurse, and she does home care now, but she was intensive care. But we basically, when we went to school, we learned about sanitation. We learned about when we went into facilities, you walked into the hospital, you could smell that hospital. You knew it was there because they were using disinfectants to disinfect viruses, bacteria, germs. We walked in there, and when we came in, we walked in our street clothes, we changed into our scrubs, and then we got out of our scrubs in our street clothes and left. And now we see people going in, they come in their work clothes, they leave in their work clothes, they've been around all these germs, etc. They may go to the grocery store or to wherever without even going home to even shower, etc. I'm interested to know what your comments are on whether these are important things that we maybe should be getting back to in order to protect Canadians.
So in BC, there's actually strict protocols in place in the facilities right now during COVID, that there has to be a change, at work, and those clothes go into a bag and they're taken home.
Right, but that's right now. That's going on right now. How about for the future? Because bottom line is these pandemics are coming. We saw it with SARS. We made these steps, but we haven't followed through with them. So are these not things we should be following through with to continue with?
I'm uncertain if, wearing street clothes into the facility, if that has a significant impact as cutting staff in infection control or cutting staff in cleaning services. I think that may be a bigger issue. Also, in cutting staff in laundry services, you don't have anybody to do that laundry anymore. And hence the issue right now of our workers not being able to get scrubs when they go in. They have to do the laundry at home and bring it in. They're not being provided with scrubs in many facilities.
Thank you, Dr.
Would it not
Kitchen.
be beneficial to them
Thank you,
to do
Dr.
that?
Kitchen. Dr. Kitchen, your time's up. We go now to Dr. Pawlowski. Dr. Pawlowski, 5 minutes, please.
So I want to direct my question to CUPE, and I'm going to preface it by saying I'm asking you an unfair question, but there's no rules that preclude me for asking you unfair questions. So I think you've done a very nice job at presenting your case about the very real significant problems with chronic care homes, the poor wages that people working in those chronic care homes get. The fact that people are overworked, that you don't have enough hours to give sufficient attention to people that you ought to. And you've pointed out how this has led to very real problems with the COVID-19 epidemic. Because of the poor wages, people go from one nursing home to another and have spread the disease. That way, when people haven't been able to work because they're sick, there's no one to fill in the gaps. And as a result, you've made some very good recommendations, I think, for national care standards. But you also listed a bunch of proposals that you thought should be implemented into trying to make things better for chronic care homes. The biggest one being that these positions be publicly funded. I think your ideas are really good. I'm certainly sympathetic, and I think members from all parties would agree that we have to do better for our senior citizens, many of whom who've spent their whole lives contributing to society and are now in a position themselves they need a little help. So I think we all agree that these are things that are needed. And now here's the unfair question, which is, okay, we agree on that, but how are we going to pay for that as a society? And you, like myself, like all of us, we're part of society. There's many costs on society. Can we as a society afford to put that much more money into looking after elderly people? And how are we going to find the money?
I'd like to answer one aspect of this and turn it to Amanda. But for starters, when you give the money to a not-for-profit employer, it is going directly to the care staff. The Office of the Seniors Advocate in BC issued a publication a few months ago that demonstrated our for-profit operators in BC under-delivered 200,000 hours. So that'd be the equivalent of a whole nother care facility that could house about 150 beds. Not-for-profit providers over-delivered by 80,000 hours. Their per diems from the health authorities are allocated in such a way that assumes they are all paying the public sector wage of $25.33 an hour to care aides, even though some of them are only paying $17. So that is one way that we could be more efficient with our money and our spending. I'll turn it to Amanda.
Yeah, I agree with the statements by Lou. The question of how do we pay for any of our public services is, of course, extremely complex and a difficult question to answer. I'm not a health economist, but one thing I have learned throughout the pandemic and realized is that where there is a will, a political will, there is a way to find the money and to provide it to the services where it is most needed to support Canadians.
Okay, thank you. I think it was an unfair question, but the benefits and the efficiency of public over private, I can certainly appreciate. I want to ask a second question about PPEs and chronic care homes and who has responsibility for it. I, as a member of Parliament in Thunder Bay, have been a little bit frustrated trying to figure out, well, who exactly is the one who's responsible for providing PPE to each of the homes? I know there's the Ministry of Health and Long-Term Care in Ontario, and they have inspectors. I know that the Public Health Agency of Canada made recommendations as to measures long-term care homes ought to implement in terms of controlling infectious disease. But some of these homes are under private ownership, some are under public ownership. Who is? I would think that the ministry is supposed to survey, but do they have any teeth in terms of enforcing the requirements for what PPEs are used, and then who pays?
To whom is that question directed, Doctor?
To QP, unfortunately.
Go ahead.
There is in the per diem amount there that are given to long-term care operators. Of course, that's part of what it's intended to cover is safety equipment for our members. So in terms of cost and who should absorb it, there have been extra funds in BC anyways. I'm not sure what's happening in the other provinces and territories to increase the amount to help operators be able to provide that.
Thank you, Dr. Pawlowski. We go now to Mr. Shampoo. Mr. Shampoo, please go ahead. 2 minutes and a half.
Thank you, Chair. We've lost sound. The interpreter is sorry.
Please start over.
Apologies. I'll start over. So my question for Mr. Lemaire, you mentioned earlier that you would like to have a bit more flexibility when it comes to posting food products, and you explained, for instance, that foods, stuffs destined to the American market that are from Canada. Now, of course, we know that some of our products are to be exported to the USA, and the labeling is in English only. Is that your position, that we should ignore official languages because of the pandemic?
C'est une bonne question. It's a very good question.
It's an excellent question.
Shouldn't ignore the official languages. But we do have to recognize the need to ensure food accesses certain populations. And currently the regulatory environment would restrict access to these foods. There is a need to ensure that Francophone Canadians can read and understand the package. So that is a core element that we'd have to still recognize moving forward. But the flexibility around those packaging is key to ensure that we can redirect food to our market where necessary.
Thank you for this, but I would like to come back to food production. Now, in Quebec, producers are only have half of their usual production. We also know that meat plants have been closed. So are we looking to restrict exports? I understand that the present situation may be exceptional, but if we can meet our own needs, you would think that other countries with whom we're trading can meet their own as well. Would we not be creating some kind of a crisis post-COVID? What are you forecasting there?
So at this point in time, we have effectively worked with government to bring a number of workers to support production to currently meet forecasted need. But that's looking at production today. We could see impacts of weather. We could see challenges in the planting, looking at it from a produce perspective. So there's still variables that are unknown as we move forward. We do recognize that it's essential to have a food security model in Canada where our domestic production can sustain domestic need. But relative to our climate as well, we go back to the international nature of fruit and vegetables and the fact we don't grow bananas, citrus, and a range of other products that Canadians are looking for. So to the point earlier on, do we have shipping channels open? Do we have access to containers to be able to bring product in? The bigger issue is also specific to availability of transport and ships. Shipping companies are now reducing the number of ships internationally. So it's not just a matter of lack of containers, it's volume of ships on the water because of the lack of business currently in the international market outside of food across the board. So the complexity of the question comes back to, do we have enough workers? No, but the industry is making do. Can we produce enough food to feed Canadians? Yes. But we need further support from government, both financially and through aid programs, to continue to drive the systems that will help production, because there are some small farmers that can't go into further debt that won't bother putting product into the ground this year. And in the fruit and vegetable industry with 10,000 family farms and 2,500 of them making up a significant size, large companies, the rest being small businesses, it's those small businesses that will be a challenge to keep going over the continuing months of COVID and as we go to the new normal in a post-COVID environment.
Thank you, Mr. Shampoo.
Merci.
By the way, Mr. Lemaire, your sound quality, for me, at least from my perspective, got really bad there. I understand Mr. Doherty has a point of order. Go ahead, Mr. Doherty.
Mr. Chair, if it's all right, I'll wait. I don't want to take any time away from Mr. Davies, so I'll wait until after Mr. Davies does his questioning.
Okay, thank you. Mr. Davies, please go ahead. You have 2.5 minutes.
Thank you. Either to Ms. Weiss or Ms. Black, this committee did a very extensive study on the costs of publicly delivered pharmacare versus privately delivered, and the Parliamentary Budget Officer found that we would save about $4 billion a year by going to a public delivery model, and we're well aware of the fact that U.S. delivery of private care is often more expensive per capita than Canada's. I'm just wondering, in the long-term sector here, do you have any information to give the committee about what the average cost, out-of-pocket costs are for a non-profit or publicly delivered bed versus a for-profit bed?
So the differences are quite substantial. The costs that are paid out of pocket varies by province. It also varies by the type of room accommodation that a resident has. So if a resident has a private room wherein they are the only individual that occupies that room, the cost is higher compared to a room that is referred to as semi-private. So it usually has 2 residents sharing a room versus a room that is termed a ward room that could have upwards of 4 residents.
If I may interrupt, if you do an apples-to-apples comparison, a private bed that's for-profit versus a private bed that is not, et cetera, that kind of comparison.
More expensive. It costs more in a private home than it does in a public home for out-of-pocket costs.
Thanks. Mr. Lemaire, if I could turn to you, you wrote a letter in April to the Prime Minister, and you said federal support is needed to help employers meet housing requirements as the typical bunkhouse accommodations.
Pardon me, Mr.
in many
Davies.
cases.
Would you speak a little bit more closely into your microphone?
Sure. Your letter, Mr. Lemaire, said federal support is needed to help employers meet housing requirements as the typical bunkhouse accommodations in many cases cannot meet the social distancing requirements being put in place. In your view, ballpark, what proportion of temporary foreign work employers are currently unable to meet the housing requirements necessary to meet the physical distancing requirements?
I don't have an actual percentage available to you today. I can get that information for you, but the challenges are widespread across the country. There has been a lot of creativity, as I mentioned, using and leveraging motels, hotels that are available. If they are, some of these are rural communities where they do not have access. So,
could you undertake to provide us those figures?
I will work to provide them to you.
Thank you. And finally, a quick question to Mr. Wilson. Mr. Wilson, we're aware of the importance of global supply chains, but of course, in a time of pandemic, I think most Canadians are very, very desirous of making sure we have made in Canada self-sufficiency when it comes to essential medical equipment and supplies. What advice would you give the federal government in terms of how we can better achieve that in time for, say, the next pandemic, or maybe a reemergence of the current one next year?
Well, I think part of the problem in Canada is, and no different than food or other things, is that what we make is, if you only have a domestic supply and a domestic sales opportunity, what you're making is very limited. And it's really hard to get companies up to scale to produce just for the size of market Canada is. The numbers sound really big if you talk about how many PPEs that everything from first responders to healthcare workers, to manufacturing workers and truckers might need. But the reality is it's still a pretty small number given the volume you could produce in a
Sorry, Ms. Wilson, can I just amend my question a bit?
Mr. Davies.
You could still export. I mean to produce in Canada for the market and export, but how can we produce in Canada?
Well, sorry, Mr. Chair.
I'm sorry. I just was cautioning Mr. Davies that his time is well up. So please just, if you could quickly wrap up your answer, it would be appreciated.
Sure. I think we can produce domestic supply. But I think a big part of the problem is figuring out the capabilities and what is actually needed and by whom across the country. And that diffusion of procurement is a really big problem in solving some of those problems, which is one of the questions asked about earlier as well.
Thank you. Thank you, Mr. Davies. And I'd like to thank the panel at this point for sharing with us your time this morning.
Mr.
And
Chair.
I understand. Hang on, Mr. Doherty. Thank the panel for your time and for your contribution and your great information. And if you wish to leave the meeting, you're certainly welcome to do that. And Mr. Doherty, you have a point of order.
Yeah, just before they leave, I just also want to say thank you to each of them. Their members and their associations are truly our heroes during this crisis, and say thank you to them for that. Ms. Black, you mentioned a study in the U.S. That was completed, and while I'm not on this panel, I think it would be beneficial to the panel or to this committee to have a copy of that report. And so through you, Mr. Chair, I was just wondering if Ms. Black knows the title or if they can forward it to the committee so that the committee may be able to review that U.S. study on long-term care. That's all. Thank you.
Thank you, Mr. Doherty. And to all the witnesses who have offered to provide information to different members, please provide that information to the committee, and the clerk will distribute it to all the members. So once again, thank you, everybody, and thank you to all the members for being here today. It's good to see you all. And with that, the meeting is now adjourned.